Hi, my name is Jacqueline Ficker. I'm a third-year medical student at OUH Cleveland, and I'm here to talk to you about my research titled TIPSITIS. This study was about hepatobiliary infection after TIPS creation in patients who had had prior biliary intervention. This was a multi-institution retrospective study. The purpose of this study was to assess whether or not having had prior biliary intervention increased a patient's risk of developing subsequent infection of a TIPS shunt. A TIPS shunt is basically a tube that is placed between the portal vein, which supplies the liver with blood, and the hepatic vein, which drains the liver of blood. Infection of that shunt is a really rare but serious adverse event. For example, in our study, 50% of people who did develop an infection of that shunt either died from it or required a liver transplant because of it. There have been limited studies to evaluate risk factors associated with infection of that shunt. However, this study was based upon findings from cancer studies that found an increased risk of infection in patients who had TIPS but had previously received intravascular hepatic procedures such as transarterial embolization procedures in hepatocellular carcinoma. This was a retrospective chart review, which included 6 academic medical centers. We were able to obtain almost 2,000 patients amongst the two study groups. Study groups included an experimental group, which was 76 patients, and a control group, which was 1,200 patients. The experimental group were patients who received a TIPS, but prior to that had received some form of biliary intervention. These procedures include bilioenteric anastomosis, sphincterotomy, internal plastic or metal biliary stents, or percutaneous biliary drains. The control group, again, were just patients who received TIPS, but had never received another biliary intervention prior to that time. We then looked at the two groups and assessed the rates of infection in both groups. Hepatobiliary infection was defined as things such as endotipsitis, liver abscess, cholangitis, infectious hepatitis, or cholecystitis. Our study found that having had prior biliary intervention did, in fact, increase the risk of developing subsequent infection of the TIPS shunts. The risks were 10.9% as compared to 0.4% in the control group, so a pretty significant increase. Common organisms that were found during culturing of the infected shunts were organisms such as Klebsiella, Enterococcus, and Candida. And other factors that were associated with increased risk of infection that were found in our study were diabetes and, paradoxically, use of post-procedural antibiotic prophylaxis. So unfortunately, patients who are receiving TIPS are typically doing so because they really need them. This is more of a salvage procedure that is used to buy the patient time and not really a long-term solution. So we might wonder what the real impact of this study was, because patients who need TIPS are going to get them anyways, regardless of their risk of infection. However, when asked about this, the authors of the study, which included interventional radiologists from all of the 6 academic medical centers, mutually agreed that there were certain indications that the result of the study would make them be a little bit more hesitant to pursue TIPS placement in those cases. This included things like just refractory ascites. So, for example, if a patient was only having refractory ascites and no other symptoms and had had prior biliary intervention, then the authors agreed that they might be less likely to pursue TIPS placement in that patient because of their increased risk of infection and the fact that the refractory ascites maybe in itself isn't an immediate life-threatening condition. Other impacts from the study was the kind of incidental finding of increased risk of infection in patients who had received prophylactic antibiotic use for the TIPS placement. Some ideas that were tossed around were things such as possibly selecting for more pathogenic bacteria with the antibiotic use, as well as possibly just this being a reflection of patients who were more likely to get infected in the first place were also more likely to receive post-procedural antibiotics.